Right, let's begin the conversation, and we have a guest in the studio, Mr. Femi Babafemi. He's a Director of Media and Advocacy, NDLEA. Thank you very much for joining us, Mr. Babafemi.
Thank you, it's my pleasure being here.
Quite a sad situation we're seeing in Kano there, not just Kano, but I know the NDLEA, first I must commend the unwavering commitment. We're seeing a lot of seizures and arrests being made, but the drug abuse among individuals, I'm sure that's where the challenge lies. But you tell us, how is the WADA campaign?
All right, thank you very much. Fortunately, you are equally well seized of the situation, especially what we are doing at the level of the agency to first sensitize the public, raise awareness, get the people to buy in and take ownership of it, the whole essence of the fight against substance abuse. And that's the whole essence of our war against drug abuse, WADA social advocacy initiative, to get the public, because the NDLEA will never pretend that it's what it can do alone, because it's a huge problem. It's a huge problem that's everywhere, just like your reporter did say. It's something that is across all the communities in the country. So, and what we're doing is first to sensitize the public, to raise awareness aimed at prevention, because that is the primary thing. If we look at the first evidence-based National Drug Use Survey conducted or published in 2018, that's over 7 years ago, you see that the population of those that had used illicit substances other than alcohol and tobacco the previous year was put at 14.3 million, meaning that we still have the majority of our population, let's say like more than 200 million people who have not started abusing illicit substances. So we have a responsibility in that regard to prevent more people from slipping into the basket of those who are using illicit substances, and that's what WADA is driving to achieve, to get the public, everybody, starting from the smallest unit of the society, which is the family unit, and to get parents, parenting, standing up to intentional parenting, so that starting from the home, starting from the family unit, everybody can do what they ought to do in their own sphere of influence to ensure that our youths, who are in the majority, if we're looking at that's about 70% of our population, we don't lose them to this scourge, that is the drug scourge. That is first, raising awareness. Two, perhaps we have those that are already slipped into that. What is the agency doing? The agency has also, through the support of the federal government of Nigeria, we have about 30 treatment and counseling centers across the country, and by the grace of God, with the support of the government, again, we do hope that before the end of this year, we'll add additional 7 to that, so as to put in place to cover the entire country, so that we can have these treatments and counseling centers attached to our commands across the country. And in the last 53 months, I can tell you that we've had more than 27,000 taken care of across all of these places, all of these treatment and counseling centers. That is huge, but then that is still a far cry from the need of the people who really need treatment. Okay. And beyond that, again, we also have, for instance, we know that there are many more people who may not be able to get into these facilities because of the fear of being judged or the fear of stigmatization. We have a call center where we have counselors, clinical psychologists, psychotherapists, and psychiatric doctors who work 24/7 every day of the week to provide psychosocial support services for people through a toll-free helpline where anybody can call from the comfort of their homes from any part of the country, and they will be provided support.
Mr. Babafemi, I'm sure you give us the toll-free line before we finish this conversation.
Absolutely.
But the campaign you've mentioned on the water, you didn't mention schools, because we're seeing the younger ones also trapped in this menace. Where is the level of campaign at the schools, the level of schools?
Absolutely. Our commands across the country have the tasking order that at least each command across the country must every week go to all of these places, that is schools, whether primary, secondary, tertiary institutions, marketplaces, motor parks, worship center, that is mosques, churches, as well as our communities. And fortunately, every one of the things we do to also show all of these activities, every Sunday, in the evening of Sunday, we take snippets of all of these activities every weekend. We produce them in a short video, which we share on our handle. So all of these activities are going on. And we don't do them alone. We go with members of non-governmental organizations, faith-based organizations, community-based organizations, civil society organizations, because, like I said, we never pretend that it's what we can do all alone, because the problem is huge. We have quite a huge ground to cover. So we go with all of these people so that we can continue to broaden the scope and the network of sensitization activities. And we do hope that as many people as possible can get into this bracket so that we can continue to make use of our sphere of influence, whether on the social media, whether in palaces, whether in worship center, whether in workplaces, all of these places where we do take this sensitization activities to everybody can log in and then get involved, and so that we can continue to get the people well aware of the issues and how to avoid this trap.
Mr. Babafemi, I'm concerned about the rural communities, especially those who are not in the know or don't have access to your campaign. Are there strategies adopted? You've been hammering on a holistic and multi-sectoral approach, you know. So are you getting to the grassroots? Because we have our young people there who are trapped.
Yeah, absolutely. That's one of the things I was trying to say, that indeed what we're doing is a whole of government approach to it. That's why we have all the relevant MDAs involved on the one hand in our interministerial committee, just to get everybody involved, and on the other hand, a whole of society, getting everybody down to the grassroots, down to the local communities. And that's why we have the state drug control committees. That's where we have where we involve the state government, the subnational government, the local government drug control committees, as well as the community drug control committees, to cascade all that we're doing at the national level down to the grassroots, down to the communities. And again, like I did say, all of these things are things we produce to show that indeed we're not leaving any stone unturned. We're not leaving, we're not closing our eyes to any sector of the community, of the society. But then I will say again that this is not what a single agency of government can handle alone. We need everybody to come on board, and that's why we continue to mobilize traditional institutions, faith-based organizations, community-based organizations, for everybody to come on board, to buy in, and continue to work with us so that we can continue to get these messages down to the local communities and the grassroots.
All right, Mr. Babafemi, we'll pick up on the conversation. Babafemi, I'm sure that report is also an eye-opener, especially if we want to put a spotlight on states' commitment, prioritizing prevention and, of course, what's the other word? Prevention and treatment. Yes. You know, earlier you mentioned that the NDLEA is, doing its best to have rehabilitation centers. But what is the level of commitment from states? Because they are the ones who get directly involved with the people.
Yes, absolutely. One of the things we have done at the national level is not just to stop all our activities at this level. We just have to get the subnational government involved. And like I said before, there is what we did. We set up state drug control committees, the SDTCC. The SDTCC is meant to work. It's the structure at the state level meant to work with our command at that level, so as to ensure that all the things that are needed peculiar to that environment are done. For instance, talking of skills acquisition, talking of rehabilitation centers. I mean, the recommendation actually to I remember that PASIDA, that's the Presidential Advisory Committee on the elimination of drug abuse, set up in 2018. One of the recommendations was for each state government to set up 3 rehab facilities in each state. That is one per senatorial district, and that's one of the things we're still pushing for the state government. There are quite some state governments that have done that, but largely, majority, they are yet to do that. That I'm certain about. But then we're still working with the state governments to ensure that this is put in place so as to, because what we have cannot cover the needs of all of the people that really need treatment. When you look at the number of people who are involved or who are struggling with substance abuse. And but beyond that, again, beyond the state, the SDCC, we also have this structure at the level of the local government too. And lest I forget, at the state level, we've encouraged all this, the state government to ensure that the first ladies, because that's the closest individual to the state government, to the state governor.
Which the First Lady of Nigeria is also campaigning.
Exactly, to get the First Lady of each state to share that committee, that state drug control committee, so that they can have all the will and the resources to do all they need to do at that level. And then we have that same structure at the local government level, which we have also moved that the local government chairman should also head down to the community, where we also believe that the traditional ruler or one of the most prominent individuals at that level should also share. And this is exactly how we're trying to get everybody mobilized, all the structures, all the needed structures down to those grassroots level. And one of the things we have also done to push this hard is to also, every year we bring all the wives of the state governors across the country to Abuja here, where we organize training, that is the DPTC, drug prevention, treatment and care training for all of them. We've had that of this year around May or so in Abuja here. We had the previous year, and the years preceded that, we've had the same trainings for them, just to mobilize them and let them understand the complexity of this problem and how...
Especially even as mothers, you know.
Exactly. Because as mothers, first ladies, will feel it more and will understand it better than any other person. So that's why we have to get them involved. And we are glad that gradually we are getting these structures activated and working in a number of states, even though it's yet to be widespread, it's yet to cover all of them. But then this, all the efforts to mobilize them, they are already yielding these results of getting this SDDC working and down to the grassroots.
Okay, so Mr. Babafemi, it's a lot of work, cut out for the agency, especially in, combating demand and supply reduction. How is the agency building its capacity, talking about its personnel, to meet target? What are you dealing with?
Yes, indeed. Where we are now, I'll tell you, is not where we were some 4 or 5 years ago. Some 5 or 6 years ago, that I can tell you. I'll tell you that with the coming of General Marwa as the chairman, chief executive of NDLEA, that has really brought quite a lot of changes. There have been quite a lot of metamorphoses, quite a lot of developments, and quite a lot of dynamics in the agency. First, let's say by 2021, the agency has a manpower of less than 5,000. Today, I can tell you we have a manpower of about 15,000. That's huge. And now we're spreading down to the local governments across the country. Beyond that, again, the leadership of the agency has really prioritized training, because the kind of cartels, the kind of DTO, drug trafficking organizations we are contending with, it's global in nature, and so we have to be steps ahead of them. And that's why you see the kind of consignments, drug consignments you have that we share with the public every weekend. You see how, it takes quite a lot of training, quite a lot of professionalism, and quite a lot of technological tools and intelligence to be able to discover all of those things. Beyond that, again, fortunately, again, I will say again that the agency has also built or broadened its network and collaboration with other global bodies. Talking of the U.S. Drug Enforcement Administration in the United States, we're working very closely with them. The International Narcotics and Law Enforcement, that's the INL in the US, the Home Office International Operations in the UK, Border Force in the UK, National Crime Agency in the UK, the French police, the German police, the Brazilian police, the Narcotics Bureau in India, that of Saudi Arabia, even down to Africa here, Gambia, Ghana, Cote d'Ivoire, and across the West African sub-region. We broadened the network. We broadened our network with all of these, our counterparts in all of these places, to share intelligence, also to have joint operations with all of them.
All right. Mr. Babafemi, very briefly, I mentioned earlier that you're going to give us a toll-free line. You want to mention that also. I'm just going to give a recommendation, if maybe they can be ambassadors, or mentors who will go to schools, who will go to communities to speak against this drug. Is the agency going to look at that?
Absolutely. Our toll-free helpline is available for anybody from any part of the country, and the number is toll-free. Nobody is paying for it. The bill is on us. The number is 0800 0010203040.
You have to take it slow.
Okay. Sorry.
Take it again.
Okay, the number again is 0800, that is 080010203040.
You want to take it one more time?
Okay, 080010203040. That's the number anybody can call from the comfort of their homes in any part of the country. And we have our experts, like I said, counselors, clinical psychologists, psychotherapists, and psychiatric doctors working 24/7 every day around the clock. They don't sleep there. They are working, they take people's calls and attend to you, refer you if there is need for you to be checked into a physical rehab center. And beyond that, one other important thing about this center is that it's language sensitive, meaning that if you cannot speak English or Pidgin English, they can attend to you in any of the 3 major Nigerian languages, that is Hausa, Yoruba, Igbo. This is to further deepen and extend the reach of this service to the people at the grassroots, at the local communities.
Okay. You have a message for parents?
Oh, absolutely. Our parents, this is the time for them to wake up and stand up to parenting, intentional parenting. I mean, this is not the era where we give birth to children and just say, God will take care of them. No, you have to get involved, because first thing first, you have to ensure that your children, we need to have parents that are bothered, that are concerned about the welfare. They are bringing the changing pattern of the lifestyle of their children. Children that used to be with you in the living room to play with the family suddenly get withdrawn into their rooms. They sleep when others are awake. They are awake when others are sleeping. The change in their eating habits. A lot of parents don't bother about what's in the backpack their kids come back home, or the change in the friends they keep. All of these things, parents need to pay attention to them, so that when these people are already experimenting with illicit substances, they can quickly get drug integrity tests conducted on them, and then we detect early and then provide them support early before the matter becomes complex, that before it gets into addiction, drug dependence.
Mr. Femi Babafemi, I must commend the agency's passion and dedication to this fight.
Thank you very much.
And for us in NTA, we'll do our part. Thank you very much.
Well, I appreciate you for that.
All right.